Good evening and welcome to the Sports Surgery Clinic webinar. First off this evening, there'll be my presentation, which gives you the general information about the Cross Border Scheme, and that will be followed by one of our surgeons. And then you can join us for a live Q&A with myself and Glenda Thorne from Finance. So you'll see a tab there, Ask a Question. If you press on that tab, you can type in your questions. Any question, nothing too small or nothing that you think that might not be relevant, just ask it anyway and we'll see what we can do and how we can help you. There'll be other tabs there you will see, and I'll remind you later of, there's one there to download the application form and there's another one to ask for advice. So we're going to start with my presentation and I will join you after the presentation to start asking questions. Thank you. Good evening and welcome to our webinar on the Republic of Ireland Reimbursement Scheme, which some of you will know as the Cross Border Scheme, and we'll refer to that tonight as the Cross Border Scheme. So I'm Fiona Roach, I'm the Business Development Manager here at the Sports Surgery Clinic and have been looking after the Republic of Ireland scheme, the Cross Border Scheme, for about the last 8 years with my team. So we've a lot of knowledge and hopefully we'll be able to help you tonight with any questions that you have. So let me first tell you a little bit about the Sports Surgery Clinic. So the Sports Surgery Clinic is a leading private orthopaedic hospital in Ireland. We look after all joints, all sports medicine injuries. We do replacements of knees, hips, shoulders. We also do all foot and ankle work, wrist and hand work, and spinal surgery. Now, most people are interested in the hips and knees, but we do other surgery as well. So we're about 10 minutes away from Dublin Airport. You come straight down the M1 to us, and then you either come off the M50, it's First Junction, or you can come down on the airport road. And we do have parking here as well. We have 7 theatres and also 4 wards. 3 MRI scanners, and we do have a dedicated sports medicine department. So, the Republic of Ireland Reimbursement Scheme, first of all, the application form. So that's what most people want to know first, is how do they apply? So to apply for the scheme, you need to contact the Health and Social Care Board. It's called the National Contact Point. So you can see here that we have the phone number, the website, and also their email address. Now, we will have a tab there for you. Later you can click on, and on our website as well. So if you can download the application form, and all the details are there as well to apply. So don't worry if you don't catch it all on this. Now, and also this webinar will be live on the website after tonight so that you can go back or you can direct people to it. So the first thing you need to apply is you have to be on a waiting list. So you have to be on a waiting list in Northern Ireland. Now that's on a waiting list for surgery. You've already seen the surgeon and he's put you on the waiting list. Some people haven't seen a surgeon yet, but they're on a waiting list and don't realise they're not entitled to apply, they're not eligible. So there are ways around this, because you could be waiting about a year to actually see a surgeon. So you could see somebody privately as long as they have a waiting list, and I'm happy to take any calls on that later regarding this. So once you have your application form filled in, you have to have proof that you are on the waiting list. So you can get a letter from your GP, or the hospital will give you a letter where you are on the waiting list. You need proof of who you are, like a passport. You need proof of address. And now they ask for utility bills, and people do ring me up and say, Fiona, we don't have a utility bill because it's in my husband's name or my partner's name. So I say, look, try and find something that's official, that has your name and address on it to prove that you live at that address, and also send in the copy of the one with your husband's address in, and that you know that you live at that address. So the other thing you will need is proof of your bank statement as well. They will want that because they want to know where to refund the money. So they're the main things that you need. On the form as well, there's section 4. When you come to section 4, it will ask you, is the Sports Surgery Clinic a private hospital or a public hospital? It's private, it's in the private sector. They'll ask you, who's the surgeon that will be doing the surgery here? Now, if you don't have anyone in mind or you're not sure, you can actually write that down. You can write down, I haven't decided yet, and then make up your mind nearer the time. They'll ask you how many nights you're going to be in. For a hip and knee, it's 2 to 3 nights. Most other things, it's 2 nights, or in some cases, it will be a day case. But you can come back to us and we can give you that information. They'll ask you about diagnosis, tests that you might need. Just put down that that will all be done at your appointment and as part of your pre-assessment, and that mostly any follow-up care you need will be physiotherapy. Also, there will an estimated price on that form. So we will, I'll give you all the numbers later, and we have a tab there to have our numbers where you can give us a call, email us, and we will give you the prices for the surgery. We have a set price for the hip and knee because it's very straightforward. It's a straightforward hip or knee replacement, also a partial knee replacement. We also do bilateral hip replacement, bilateral knee, and bilateral partial, and we have those prices. They're package prices, so they're inclusive. Other things though, like you might want a price if you're having a shoulder surgery, ankle surgery, back surgery, and for those prices we will need a letter that shows us exactly what surgery you're on the list for, and we can ask our consultants to code those for you, and we can give you exact pricing. Now, the application form used to take about 30 days to get processed. At the moment, they are inundated with applicants, and it is taking 4 to 6 weeks, even at some stages up to 8 weeks. Now, so just to be careful with that and have that in your mind that you might be waiting for the application form for about that time. Payment-wise, when you get your refund, you are refunded. Now, normally it was 3 weeks. Again, I think at the moment it could be taking a little longer, so just be aware of that too. Now, the actual surgery itself. So once you've got your application form in, you have your approval, you can contact myself, Fiona Roach, and Janice Malloy, and Glenda Thorne to discuss the application process and what to do once you receive approval. Now, Glenda Thorne will be the person, she's going to join me later for this to talk through. She's your finance contact. So she might be the person you come to first, and then she'll direct you to me. If you come to me or Janice and we need to know more for you for pricing, we'll direct you to Glenda. But other than that, really myself and Janice can give you all the prices for the joint replacements on hip and knees. So, and all those numbers will be on that tab. So included in the price is hospital stay in a semi-private accommodation. Now, semi-private is a room where there are 2 people in there. It's not a private room on its own. Your first appointment, your pre-assessment plus a cardiac echo if needed, your surgeon and anaesthetic fee, pre and post-op x-rays are included for the joints, the foot and ankle as well, and any shoulder surgery. It includes your stay in hospital, 2 post-operative appointments, and your COVID swab. Now, what's not included in our package prices? If you need any additional consultations, for example, if you go to pre-assessment and they find that you maybe have a cardiac issue or an issue with your kidneys or your liver, etc., something that was unexpected, and they need clearance for surgery, then you may have to go and see a consultant here who will give you clearance, and that you will have to pay that fee. Now, a lot of these days are actually on the phone, so it's not as expensive. But you're looking at, if it's a phone consultation, it's probably €60 to 100, and a face-to-face consultation, you're looking at around 250. The other things included in that are not included would be any extra investigations. For example, you came in, often this would be maybe with spines or anything like an ACL, you might need to get a new MRI. That's not included either, so you would have to pay for that. Now, as well, you don't have to have those things done here. If you have a consultant in Northern Ireland, or you can get the MRI done in Northern Ireland, you can do that and then just give us the letters or the reports. What's not included though is a private room. If you do want to have a private room, Glenda will give you the price of that. And also, it's not guaranteed also that we have a private room, because most of our rooms are semi-private. So, when you are deciding that you want to come here, some of you will have already decided on a surgeon. So, and some of you won't. If you have a preference for a surgeon, that's absolutely fine, and we will send that information onto that surgeon for you. At the moment, appointments and surgery will be complete, we're saying between 6 to 8 weeks, maybe a bit longer now with the summer and people away, but you're looking roughly up to 2 months' time that you would have your surgery. And differs again between surgery and procedures. Now, to save you travelling up and down, we do book your appointments and your pre-assessment on the same day for joint replacements. It just saves you having to do too many journeys. Appointments can be made on receipt of approval. Now, also, some people, if you're waiting for 8 weeks, would quite like to start the process and make their appointments, and we will try and do that for you, just to make the appointment for the pre-assessment and also the consultation. But really, you have to be careful that you don't have a surgery date before the 8 weeks. And also the national contact point, they prefer really that you don't book anything until you have your approval, so that you're not ringing them because you're worried you're not going to have approval in time. So make sure if you want your surgery date before you have your approval, that it's booked in advance of the 6 to 8 weeks that you might be waiting. So once you're here, and then the other question, a lot of questions people ask about when they go home. So look, you're normally going to be in 2 to 3 nights for the joint replacements. So there are, if you have relatives who want to stay, there are local hotels. We do have corporate rates with those hotels. If your relatives need to stay, that hotel at the moment is, one of them is the Carlton Hotel at the Dublin airport. Now the Crown Plaza and the Holiday Inn we do, but they're being used at the moment during the quarantine period. So also, if you need convalescence afterwards, it's important really, if you need convalescence or any care at home, that you do let us know beforehand, just so that we're aware. It's very hard to kind of organise everything once you're in. Now, and I know it's a bit of a catch-22, we can't send the referrals up to your boards of trusts until you're in, but at least if we have a bit of warning, we can do a bit of groundwork, and you can do some groundwork and see if they can find somewhere for convalescence. It is harder to get convalescence these days. It is easier maybe to organise a social care package. Physiotherapy, you're entitled to physiotherapy when you go back as well. So now there may be a bit of delay on this. You might not be able to get back into the local hospital you'd like to get into. So if you have something, especially knee surgery, ACL surgery, knee replacement surgery, I advise that you book some private sessions first while you're waiting to start your physiotherapy in the local hospital. Now, the other thing on discharge is that the Cross Border don't pay for your medication to take home, and the GPs aren't always able to write you a prescription when you go back. So it has been suggested that you get your medication here, and then that when you go back home, that you have your prescription and you have all your medication with you. So we do recommend that you don't leave Dublin without getting your medication, just in case you go home and you can't get it from your GP. So we will give you a special form for that you take to, there's a number of chemists, and we will give you their names, and then so you stop there on the way home with this form and they will dispense your medication to you. So if you've any problems afterwards, contact the surgeon's room or contact us, and also we have a discharge nurse for the knee replacements. Contact her as well. Don't worry about contacting us. The consultants would rather know if there's a problem, if you're concerned about the wound, or if you have an infection or anything like that. Please let us know, and we will bring you back down to see you. Now, COVID is still a problem at the moment, so it's still no visitors at this time when you come for admission, but you can have somebody with you when you come down for your appointment and your pre-assessment. One person with you for appointment and pre-assessment, but still unfortunately no visitors when you're having surgery. You will require still a PCR test 72 to 48 hours before surgery. Now, you can have that done here, but most people don't want to travel down so soon to surgery, and they are having the test done in Northern Ireland. Now, you can I can't get it done really at health centres anymore. You have to go privately. I think Randops are still doing it up in the north. So I would pre-book that. Now, what we will do though, we will take the 150 off your overall price here if you have your test done in Northern Ireland. So you just need to let us know that you're having the test done in Northern Ireland, so we'll cancel it here and we will take 150 off the cost for you. And you just need to let them know this when you're paying. So when you have your PCR test as well in Northern Ireland, make sure you bring the results with you on the day of your admission. So a lot of people ask these questions because on the application form it asks you, do you need insurance or have you taken out insurance? You don't, there isn't any insurance really that will cover you. There's no travel insurance or medical insurance that will cover you to come down here to have your surgery. But what happens if there are complications? If you have a complication that's not related to the surgery, but so you have a problem with your heart or a bowel problem, we can admit you into the local hospitals here, which is normally Beaumont Hospital or the Mater Hospital, so that they will look after you. Now, you normally would have had the EC1 card in the past. We do suggest you take out, there's a card now called the Global Card, which suggests you make sure you've applied for that and you have that as well. So that will cover you when you're here if there are any complications. It's very rare that these things happen. You know, it only happens maybe once or twice a year, but if it does, it's good to be prepared for it. If though you need to be readmitted here within 30 days, we don't charge. There's no charge. So you come down, there will be no charge on that. So now, where to find us? So there's the map there. This is where we are. As I said, we're very close to Dublin Airport. So I am going to join you later on and will ask all the questions that you need, answer any questions that you need. Glenda will join me as well, and we are going to have a talk with Gavin McHugh as well, one of our surgeons here. Thank you. Hi, welcome back. So Mr. Gavin McHugh is going to have a presentation now. Gavin's one of our orthopaedic surgeons here. He's a hip and knee specialist. So have a listen to his talk, and then I'll be back with Glenda from finance and we'll answer any questions you have. So please press the tab for ask a question and type in your questions if you have them. Thank you.
Good evening, everyone. Gavin McHugh is my name. I'm a orthopaedic surgeon based in a sports surgery clinic in Dublin. Fiona has kindly asked me to say a few words on the Cross Border Initiative based on my perspective of it, I suppose. So my area of expertise is hip and knee, and within that there, I suppose I mainly do a lot of hip replacements, knee replacements, partial knee replacements, and then soft tissue knee work such as arthroscopies and cruciate ligament reconstructions. Within the clinic as well, we've a broad area of expertise that covers really all the subspecialties, including spine, upper limb from the shoulder, elbow and hand, and obviously then foot and ankle as well. I think over the last few years that I've been here, I've really a huge part of my practice has grown into based on the Cross Border Initiative, and I certainly have had dealt with a lot of happy customers from the north. From my point of view, really, I say to people that, and there's obviously people are coming down and they're a little bit skeptical over what exactly is involved. And I say to people, I haven't really seen any catches in the whole process. It actually has been quite streamless, and they've done a lot of work in the cross-border office to really make it as easy for patients as possible. Now, from a sort of principal point of view, lots of people have issues with regards to moving away slightly from the NHS. And I completely understand that, but from my point of view, when I'm seeing patients who are in a really bad way and are looking at waiting lists that are potentially years and years long, I mean, I think ultimately you have to make a call that's right for yourself. And I say to people, if that means being selfish for once, well, so be it. I certainly don't have any problems with that. And we have a similar process here in terms of lots of patients end up going the other direction, and there are lots of waiting list things such as the treatment purchase fund that are going on all the time. And ultimately, I say to people that there has to be a safety net there for people, because this is another concern that patients have, and ultimately the NHS is still responsible for your care. So if you're on a waiting list for a hip replacement and I perform hip replacement, if there's a problem in the few weeks after the surgery, I'll certainly deal with it. There's no issue with regards to that. If there's a problem down the line, your consultant up north is bound to still look after you, and the same works both ways here. So you can be rest assured that it's not something that you're going to be left behind on. And in terms of what you get, I mean, and I can quite safely say that the care you receive in the sports surgery clinic is state of the art and among the best in the world, I'm happy to say. There, as I said, there are no real catches in the care. And I say to everyone, this is something that I've really fought for over the years, in that the price that the clinic gave you for the job is the price you pay. And if there was any problems and you stay in another night or two in hospital, there's no issues with regards to that. You know, essentially what we want you doing well following your procedure. We want you going home safe. We want you going home pain controlled. And ultimately, as I say, doing well. So in terms of just, I say what I do in terms of the breakdown, the vast majority of patients that I see are either hip or knee replacements, I mean that really speaks for itself. Within a hip is a hip in many ways, in that by the time that people have developed a lot of pain, really the only option for them is a hip replacement. And there are various methods of putting this in and various different types of prostheses, but they're really on a par nowadays. In terms of knee replacements, there are slightly more options, in that I have particular interest in partial knee replacements rather than just full knee replacements. And quite often, lots of patients I'll see have been told that they needed a full knee replacement, and I end up offering them potentially a partial, which has advantages in terms of the recovery process and indeed the knee that they have afterwards down the road. One other area that I have sort of really developed an area of interest in is potentially looking at having both joints done at the same time, as in either both hips together or both knees together. And this is something that potentially sounds quite daunting to patients initially, but obviously the huge advantage in it is getting everything over with one operation and one recovery process. And again, particularly when I'm seeing people who are really in quite a bad way, and plenty of them barely able to walk, I think it offers huge advantages in terms of getting the back on track again. Again, it's not going to be something for everyone, but pretty much every week I'll do one or two patients with both hips and the same potentially with both knees. And again, just back to the partial knee, then when it's obviously much easier to have both knees done if you're just getting partial knees done. I'm not going to lie to people and say that having both knees replaced at the same time is an easy thing to go through. It certainly isn't, but often it's a real case of grabbing the bull by the horns and just getting on with it and trying to get really your life back on track again. So really that's it from my point of view. As I say, it's pretty straightforward, the entire process. We've done a lot of work to try and make it as seamless as possible for people. We'll try to combine the pre-assessment, as in the medical check that you get on the same day as the consultation, insofar as it's possible. And then really all it, apart from the surgery itself, which is usually for a hip or knee replacement, usually around 3 nights in hospital. And then all that will be involved is one post-operative check around the 6-week mark from me. And different consultants might vary slightly in that, but for me, that's the entire process. So as I say, it's as seamless as we can make it. And really that's it from my point of view. I'm happy to see everyone and have a look and certainly give my opinion. And I often laugh at people saying, you know, sir, or doctors differ, patients suffer, and really that's not the truth. In many ways, it's very important that I see you beforehand and make sure that I'm happy with the choice of procedure that has been recommended for you, and we can certainly have a discussion in that regard. And I look forward to seeing many more patients. Thank you very much.
Hi everyone, Glenda Thorne is here from Finance. Glenda's in Finance and she'll answers all the financial questions you may have. So we're going to start now with first question. How long will the cross-border scheme last? Now, as you know, the cross-border scheme was supposed to finish on the 30th of June, and then they extended it by 5 million. And I think at the moment, it's if anyone that applied before the 30th of June, they will process your forms. And after that, they have the 5 million, which once that's gone, they will then reassess, and we'll have to see what commitment they're going to make about funding. So if you have an application form ready to go, I would suggest that you put it in as quickly as possible, because we're not sure exactly how long that 5 million is going to last. Okay, now let's see what else. Susan, what medication am I entitled to on the cross-border scheme? Now, we had a chat actually with the National Contact Point about this. So what we do suggest is we normally give about 4 to 5 days worth of medication, but you do have to purchase that. It has to be purchased from a chemist on the way home from here. We don't have a dispensing pharmacy here, but we have a number of chemists. And what we do is before you go, we give you a leaflet to take into the chemist. They know exactly that you're part of the cross-border scheme and what medication you require. Now, GPs then, if you need to go back and get another prescription from your GP, a lot of the GPs can't see you for about a week. So now they are suggesting that you get your medication down here for longer before you go home. So even what I would say, definitely get the 5 days worth before you go. Sometimes the medication that's written up down here might not be available in the north, so the GP may have to change that medication, and that's okay. We're aware of that sometimes the medication across the border isn't exactly the same. But it is a question that some people ask afterwards, so please, it's something that maybe you do want to talk to us later, and you can email myself or Janice about that. Okay. Now, so does a copy of the letter from an NHS consultant to my GP saying he's put me on the waiting list suffice as proof that I'm on a waiting list for the purpose of the Republic of Ireland application? Now, yes, that does suffice. That's perfect if you can get a letter from your GP. The other place to get a letter from is maybe from the consultant's office in the hospital that you attended. That will also be proof. Or from the waiting list people in the hospital you attended, that's also another way to prove that you're on the waiting list. So, where's that one? There. I'm just having a look down here. Okay, there's another question here. What is the normal recovery period for a hip replacement? Now, so the normal recovery for a hip replacement, when you can go back to work, so that does depend on what kind of work you do. So you will be on crutches for 6 weeks following surgery. You come back, normally you see the consultant after 6 weeks, and then he may put you on one crutch, and then gradually you come off that. So it really does depend on what type of work you do, whether it's manual or whether it's office work, and how long you can sit down. You have to have the right chair to make sure it's the right height. So that you can discuss that with the surgeon. So when you come for your first appointment, that's a good time to have that discussion. Just say to him, this is what I do. When do you think is a good time for me to return to work? But be prepared that you are on crutches for 6 weeks after surgery. Also part of that question was, so Mr. Clausen, there are pre-assessment and consultant appointments available in the evening or the weekends. Now, pre-assessment and consultant appointments, sometimes, no, they're not really available at the weekend. Maybe you'll get a consultant appointment in the evening, but the pre-assessment finishes at around 2 o'clock. So that's always, or you can get one very early in the morning at around 7:30. I know that's early if you're traveling down from the north, but you can have a chat. But at the weekends, at the moment, no, that they don't see people at the weekends. I've had approval for reimbursement. Can I book surgery straight away? Once you've had approval, you can contact us and we will book you into a consultant. Like I said, if you have a surgeon in mind, then we're happy to transfer you to that surgeon and you can talk to him about dates. But yes, as soon as you get that approval, let us know. So I've been approved by the scheme for 1 hip replacement. My consultant at the pre-op has advised that I need 2 hips replaced. I'm not on a waiting list for the 2nd hip replacement. Can I go ahead with the operation? Okay, so if you been on a list for one hip but not the second hip, you can't have both of them done. So what you need to do, if you want to do bilateral hips on the same day, then you need to go back and to your surgeon and see if somebody can put you on the list for the second hip, and then talk to the contact point and ask them to approve you for the second hip. Sometimes a letter from the consultant here saying that you need both done at the same time that can be sent back to the contact point. They might be able to put you on the list with that. But don't assume that if you've got approval for one hip that you can get the second one approved, because they won't do that. You do have to have separate approval or get approval for the bilateral hips. Now, on one of those questions I was just asked as well about whether you have a spinal or a general anaesthetic for a hip replacement. Now, you have talked to your consultant again about that, but they do under spinal with sedation as well. So that's a discussion that you will have. So, question here from Norman. My consultant has advised I need half a knee. Could this change when I see the doctor at your clinic? Yes, it depends when you saw the consultant. So some people, they're on the list for a couple of years. It could have changed from a partial knee, they call it, to a full knee. Sometimes when they do go in, they see that, and it works both ways. Some people, they'll go in and look, you think you're having a full knee and actually you only need a partial knee. So that can work both ways. But the consultant, once he does the x-ray, will have a much better idea. When you come down, we tend to always do a new x-ray at pre-assessment anyway. And Glenda, that's included in the cost, isn't it?
Yeah, we have all pre-assessment, regular pre-assessment tests are included in the cost of the surgery. The only thing that wouldn't be included is if you need to see a cardiologist. If there's any cardiology problems. That's just how to scope of the pack.
Yeah, so, but yeah, so you know, so don't worry if you've had an x-ray a couple of years ago or you had one even 6 months ago. We probably will need to do a new one and they can assess you then. That's another one. Okay, on yesterday's local news, the NHS require a lateral flow test prior to surgery. You mentioned needing a PCR. Okay, so here it still is a PCR test. So it's 72 hours to 48 hours before surgery. Now, this hasn't changed yet, but it is likely that maybe in a couple of weeks we might stop doing the PCR. So once that happens, you won't need to worry about what test you're going to need. We will also, Glenda, cost-wise, that will be taken off the total cost, won't it? Yeah.
Yeah.
And what will they do then if that's going to happen? So it's really for people going forward who don't have the PCR, we'll give them a new price.
Oh, we'll give a new price. Yeah, we charge, we include €150 in the total package rate for all surgery. So if they're not being included going forward, I'll reduce the package rate by €150.
Okay, lovely. So also though, so what will happen probably then, now that this isn't for definite yet, but if this does happen, we will put something up on the website and you can ask us that question anyway. But what will be, if you have any kind of cough or cold, any symptoms of anything, you need to probably do an antigen test before you come down to double check and just see if there are any signs of COVID. Normally anyway, before COVID, you wouldn't be having surgery if you had any signs of flu either, so everything would be delayed. Can you help me with the application form? I have a few queries. Is there someone I can contact with the team? Okay, so the application form is quite, it seems a lot more complicated than it is, but it is, they do ask very specific questions. It's particularly, Glenda, if I'm page 4, section 4.
Yeah, I get an awful lot of patients who have problems with the application form, and if they're just making inquiries for the first time and they're just filling out the application form, there is a section to state the facility, which would be Sports Surgery Clinic, and then also to state the surgeon. But if you don't have a surgeon booked in, or you don't even have a surgeon in mind at the moment, obviously we can pick a surgeon for you, but for that section just put down not decided yet. And that will suffice for the application form.
But look, we're really happy. There's myself, Glenda, and Janice. We're happy to help you with those forms if you need to, because we're very aware that there are questions on there you're not quite sure about. And as I said, if you ask you about a surgeon, you just say that you haven't decided on a surgeon. You don't have to come and see a surgeon here before surgery. In fact, you know, before you put that application form in, you don't have to visit Sports Surgery Clinic or see anyone here. You can just put that you haven't decided who's going to do the surgery for you. And then we can help you with the other bits. They do look for an estimated cost. And as I said, for hip and knee replacement, that's very easy for us to give you a straightforward price, but you definitely need to talk to Glenda if it's shoulders, backs, wrists, hands, ankles, because it's more complicated.
Yeah, Fiona, if it's anything other than hips and knees, the shoulders and ankles, specifically shoulders and ankles and feet, they can all be done as multiple procedures. So what I would need in order to get you a price and price it up and code it up would be your referral form. So once we get your referral form, we can get your price, no problem.
Someone else had asked me actually as well, do we supply crutches? So we do supply crutches. So once you've had your surgery, if you need crutches, we supply the crutches, and you keep those crutches then. Another question here. I understand there are several methods of hip replacement. My osteopath talks about anterior surgery. Is this possible? Now, all our surgeons at the moment do posterior hip rather than the anterior. We may have one surgeon now that will be doing the anteriors, but it is much more common that we do the posterior. But if you are interested in that, maybe contact myself or Janice separately on that one, but the cost is the same. Okay, now that's all the questions. So we will, as I said, you have our numbers and emails. So just call those. There's a Republic of Ireland email address and phone number. So just contact us and we'll help you with those. This webinar, as I said, will be live on the website, so you can go back and look at it. Or you can, if you know anyone that's interested, they can also go back and have a look at it. So thanks very much for joining us tonight.
Thank you.
And yeah, please contact us if you need any help.